Hey everyone, I'm back. Here's the second part of some introductions of what you need to do and what you shouldn't do, and some other information. So, what not to do. Um, do your best. Don't smoke before going in for a massage. It can make your therapist uncomfortable. What happens is the nicotine and the other chemicals in the cigarettes go through your system, and then they come out through your sebaceous glands, and it doesn't smell good. It's not comfortable for you. It's not comfortable for your therapist when you smell like smoke. Um, Same thing goes for strong foods, seafood, garlic, onion. Those all come out through your skin. You will smell it, you'll smell like it, and it's not comfortable. Um, Along the same line, don't wear perfume or body spray, deodorant. If you can avoid it, you should be coming clean, you should be coming showered. Um, a lot of therapists are going to have in their facilities showers. If you need to come like straight after work, then you can ask to use the shower. They should let you. Um, if your feet smell, if you've been working all day and you haven't had a chance to wash your feet before you come, you can ask for either foot soap with essential oils and Epsom salts to help with foot odor, and it might cost you a bit more, 15 or 20 bucks or something like that, but it shouldn't even be that much. Depends on the therapist. Um, but yeah, try to be clean. Try not to wear anything scented because it'll interfere with your massage. Your therapist will be less comfortable. You'll be less comfortable. Um, don't bring valuables to your massage. If you have to, put them in your purse, put them in your pockets if you're a guy. Rings, necklaces, jewelry again. It's not a good idea to have it with you. It just increases the chance that something will get lost, or you don't want to have to accuse your therapist of taking something from you if you lost it there and then find out later that you left it at somewhere else. So it's best just don't bring it. If you have to bring it, put it in your purse or your pocket so that you know where it is, or leave it out in your car. Um, Same thing with your phone. Obviously, keep your phone on silent, like I said before. Um, and then the next one's really important. Don't expose yourself to your therapist. And a lot of guys want to have their top half exposed. They feel comfortable with it. Um, it's not necessarily okay. It depends on the area, but it's best if your therapist and you keep, even as a guy, your chest covered. That means down to here, above the nipple level is okay, but down to the nipple, that's fine. You don't want to have anything below that exposed, except you don't want to have your nipple exposed ever. That's not okay for guys or women. Um, so your therapist should be draping you properly, but you also, it's your job to make sure that you're also properly draped. Um, don't lift up your legs or anything when you're draped, because then it'll expose things that shouldn't be exposed. Um, it's kind of common sense. Just don't do it. We're not doctors. We shouldn't be seeing private areas on you. Um, so leave that to your dermatologist and your significant others. Um, this is another obvious one. We are massage therapists. We aren't masseuses. There's a difference. Massage therapist is a medical professional. A masseuse is someone who gets paid to give you a rub down. And so we do not do happy endings. This is not the place for happy endings. Your therapist should not be offering you happy endings, so don't ask. If they are, then you are in the wrong place. You're not at a massage therapist, and you need to find a different one. There's a lot of back corner places, and you don't know if your therapist is um, certified. If your therapist should be able to show you that they are certified. They should have their insurance. They should have their cards. They should have their everything displayed properly. If they don't, there's a problem. So make sure your therapist is legit. Um, Another thing you don't want to do is help your therapist. Like if they're doing stretches, then and you start helping them, you're not getting the relaxation out of it. If they're doing a stretch, or they're moving your leg or your arm or your head, then you're not able to relax completely. You're helping them, and it means that you're not completely relaxed. You should feel comfortable allowing them to pick your head up or your arm up and move it wherever they need to move it. Um, and if you're not, then you need to let your therapist know. Something else is you need to be comfortable. Um, you don't want to talk throughout your massage. It's really good to give them good feedback. So if the pressure is too much or too little, you want more pressure, feel free to do that. Feel free to let them know if they're using something hot like a hot towel or a hot stone. Obviously tell them if it's too hot or if it's not warm anymore. Ask for bolsters, ask for pillows if you need it to be more comfortable, but at the same time, you don't want to be having a conversation. They're taking time out of their day where they're not interacting with other people, and then that time is just for you. By the same token, you don't want to get less out of your massage because you're having a conversation with your therapist. You're more relaxed when you're having a massage, so you're going to feel more comfortable with your therapist, and you might end up oversharing, and you don't want that to happen. It can mess up a professional relationship, and then you won't feel comfortable going back to your therapist. And especially if they're a good therapist, you don't want that to happen, because then you won't be comfortable getting massage from them in the future. It hurts both of you because they're not getting your business and you're not getting their therapy. Draping. You should be comfortable with your therapist draping. Like I said before, they shouldn't be exposing anything on you. They shouldn't see anything that a bathing suit doesn't cover, or a Speedo, or a bikini top. So you should always be covered up, and only the part that they're working on should be exposed. So if they're working on your arm, then they'll have your arm out. If they're working on your hand, they'll have your hand out. And I mean, those aren't private areas, so they shouldn't be too much of an issue. You can have your arms on top of the sheet if you want. Obviously, they're also not going to cover up your face when they're not working on it. But like glutes, they're going to be covered up unless they're working on it. Legs, they're going to be covered up unless they're working on it. Abdomen, back, unless they're currently being worked on, or they just went to grab a hot towel to put on you and they should have those close, then it should be covered up. A lot of people also wonder whether they should wear underwear during their massage or not. You don't have to. If you're comfortable enough to have someone working on you and touching your body, you should be comfortable enough to not wear underwear. They shouldn't be exposing your gluteal cleft or butt crack. It's the same thing. They shouldn't be exposing anything else, so you shouldn't feel the need to wear underwear. They will be exposing your glutes, and a lot of people may not be comfortable with that, but it is a part of you. Like I think I said before, you need to have it worked on. Your back muscles connect there, your leg muscles connect there, and if it doesn't get worked on, then you're not going to be able to relieve all the stress in your back or legs. A lot of people will have their glutes skipped, and then they have lower back pain because of it later, because they didn't have the muscles that attach there finished worked out. Another thing is piriformis syndrome. Piriformis syndrome, there's a small muscle underneath your glutes that is right next to your sciatic nerve, and your sciatic nerve comes out down your spine and out through your sacrum and then down your leg. And when the piriformis gets tight, it can compress the nerve and cause nerve pain. Nerve pain is sharp shooting, burning pain. People will think they have sciatica. It's not sciatica necessarily. Your doctor can tell you if it's sciatica, but it's definitely not sciatica if it goes and comes. It's piriformis syndrome most likely, and that can be relieved through the massage. Sciatica is actual nerve damage to the sciatic nerve. It comes when people put too much pressure and think that it's sciatica and grind and put pressure on it, and damage the nerve by putting too much pressure on it. So you can ask your doctor how to treat sciatica. You can get medication if needed for it. But massage can help with sciatic pain caused by piriformis syndrome, and that's another reason why your glutes should be worked. Let's see. So even if you're not comfortable having them work on your glutes directly, you can still have them work on it through your underwear or through the sheet or through the blanket and the sheet, and still be able to have that worked out. They're not groping you. They're not trying to fill you up. They are trying to release tension in your back and in your legs. If you are uncomfortable with it, or you feel like they are trying to fill you up, there's a problem. Again, you might not be at a reputable therapist. Definitely check that out. If they do expose you, if they do touch you inappropriately, obviously report them to the police and then to their insurance and their certifying companies, organizations, whether that's in California CAMTC or National NCBTMB, or depending on what state you're in, you have a massage board that you can report that to. Be open in asking for more or less pressure, like I said. The therapist can feel how much pressure they're giving from their end, but they can't feel how you're feeling it. So what is good pressure for one person, even more than preference, what's comfortable for one person may be way too much pressure for another person, or way too little pressure for another person. If you're ticklish, let your therapist know. They can give more pressure. Most of them know how to work in areas so that it's not ticklish. Feet are a main thing, armpits. I myself am extremely ticklish, so I'll let my therapist know if I'm having massage, where I'm ticklish, what areas are especially sensitive. So yeah, your therapist can't feel what's too hot, what's too cold, what's too much pressure, what's too little pressure, because everybody's different. Um, I think that's it for now. If you have any questions, feel free to ask them. I have an inbox. Feel free to subscribe. I appreciate it. Share these with your friends and family. Um, like them, please. Click the like button below. If you have any suggestions for anything I could do better, any questions, advice, feel free to leave it in the comments. Feel free to send me a message. I really appreciate it. It really helps me out. So thank you. I'll see you guys later.